30-year life expectancy between two neighborhoods that are less than 10 miles apart, and that's the largest life expectancy gap between neighborhoods of any city in the United States. So on a topic as important as this, action is going to speak louder than words, and get started somewhere. The time to do it is now, and so we're certainly happy to be engaged in that important work in collaboration with other partners in our local market.
There's so many factors when we talk about building health equity that are outside of the healthcare industry, and that can be, I would imagine, overwhelming when people think about how can we possibly get this done. Do you get that in your conversations?
I do, and I actually I try to address it up front in those conversations. And sometimes I'll use the phrase, we can't boil the ocean. And since we sit here in Chicago, I'll say we can't boil Lake Michigan. There are going to be some things that we can address that are kind of squarely in our swim lane, and we should do it. There are going to be some things that are in very close swim lanes that we should also address, and some of those you may address directly, some you may address indirectly through partnerships with others. And despite the magnitude of the issue, it's not something that we can walk away from and say, hey, it's too big to address. Our approach isn't going to be perfect, but it should be pretty darn good. And we should also ensure that we're working collaboratively with other organizations, some of whom may be better suited to tackle certain issues, to help ensure that collectively we can be successful. That's what leadership is about. Doesn't mean we have to do it all. We have to do our part. We have to ensure that we inspire others and serve as a catalyst to ensure that we're able to move and advance health for our communities through our collective impact.